mode.
Hello, my name is Karen Odegaard, and I am a Community Health Improvement Specialist with the County Health Rankings and Roadmaps program. I am joined by my colleague Sarah Ansel.
Hello.
Sarah's going to be answering your questions as well as sending out some links via the chat box throughout the webinar today. We're also excited to have Susan Brutschy with us today to talk about how Santa Cruz County, California has used results-based accountability.
Hello, it's a pleasure to be here with you today.
Welcome, Susan. Thanks so much for joining us.
Thank you.
So first, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Next, we want to take a moment to get you oriented to the technology that we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window. This is where you'll see our screen throughout the presentation. On the right, you can see the control panel. This is where you'll find handouts for today's session, including a PDF of our slides, a list of related links that we'll be sharing during the presentation, and an overview from Susan about her company. You can also interact with us in the control panel by using the question section. Feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today. And we'll definitely be sure to leave time for your questions toward the end of the webinar. So this question guides our webinar today. How could results-based accountability help your community build a culture of health? We also want to hear from you. How have you connected population-level data to local action? So what kinds of data have helped drive action in your community, and how have you made that happen? We'd love to hear your examples. So please feel free to use the chat box to share with us what has worked well in your community or what unique challenges you feel like you're facing with connecting population-level data to local action. If you can, be sure to include your community's name so that we can share with others on the webinar. As we move into the actual content of the webinar today, we'd like you to consider these questions as you listen. Who else do you need to share this information with? What is one idea for action that you're taking from this webinar? And what else do you need to know to take action or use this information? We'll have time for your questions before the end of the hour today, and we'd also like to invite you to stay with us for 10 to 15 minutes of after-class discussion after the webinar. We'll have some instructions for you a little later, so that you can ask your question directly to Susan if you'd like. Otherwise, the question feature will still be available to you to type in questions. We'll start with a brief program overview to ground our discussion in the County Health Rankings and Roadmaps. This will take about 5 minutes. If you're newer to us, this will give you a high-level overview of the County Health Rankings and Roadmaps program. To learn more, we encourage you to check out one of our Rankings and Roadmaps 101 webinars. We've got one coming up next week, and Sarah will share the registration information with you in the chat box in a moment. The County Health Rankings ranks the health of nearly every county in every state. For each county, you'll find two rankings, one for health outcomes and one for health factors. The image here shows the relationship between policy, health factors, and health outcomes. It illustrates why it's important for communities to take a broad definition of health. Many factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools. Lots of things impact our health outcomes. So this image tells us that starting from the bottom, we can see that we know that effective local, state, and federal policies and programs can improve a variety of factors that will in turn shape the health of communities. There are several health factors that shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes to show how healthy each county is: length of life and quality of life. As Susan talks about results-based accountability in Santa Cruz County, many of her examples will draw from their work with youth violence, which falls under community safety in social and economic factors on our model. So this is challenging work, and we know that communities sometimes want or need support to figure out first steps or next steps. With that in mind, let's take a look at the Roadmaps to Health Action Center. The Take Action cycle is the how within rankings and roadmaps. It lays out the process communities follow to improve health. You gather information to assess needs and resources, set priorities so that you can focus on what's important, find the most effective approaches to address your priorities, and then get to work on acting on what's most important. And of course, evaluating throughout the cycle will help you improve your strategies and ensure that what you're doing is effective. You'll see that communicate and work together sit outside the cycle because working together and communicating with stakeholders is essential throughout the Take Action cycle. At the heart of the Take Action cycle is people working together because we know that solving issues like childhood obesity, poor high school graduation rates, or crime and recidivism require the wisdom and resources of everyone in the community. The Roadmaps to Health Action Center includes guidance and tools to help communities keep moving along this cycle. In today's webinar, we'll hear how results-based accountability has played a role in how Santa Cruz County both assesses their needs and how they evaluate their actions. You'll also hear about the important role that work together and communicate have had in their work. We'd also like to take a moment to introduce the RWJF Culture of Health Prize. The RWJF Culture of Health Prize is a partnership between the University of Wisconsin Population Health Institute and the Robert Wood Johnson Foundation. The prize honors and elevates U.S. communities that are making great strides in their journey toward better health. So on your screen, you'll see 6 criteria that are central to the RWJF Culture of Health Prize. The prize recognizes and celebrates communities that have placed a priority on health and are creating powerful partnerships and deep commitments to make change that will enable all in our diverse society to lead healthier lives now and for generations to come. The prize is awarded annually by RWJF, and communities that are awarded the prize work across health factors by defining health broadly. They are strategically focused on policy, systems, and environmental change, and look out for all, including the most vulnerable in their community. These communities work collaboratively with partners from across sectors, use resources wisely and creatively, and they measure and share success widely. Santa Cruz County, California is a 2013 RWJF Culture of Health Prize winner. You can learn more about Santa Cruz and all of our other 2013 and 2014 prize winners at www.rwjf.org/prize. You can also consider applying for the 2016 RWJF Culture of Health Prize. To learn more about prize eligibility, criteria, the selection process, key dates, and to start the application, you can again go to www.rwjf.org/prize. 2016 applications are due on November 12th at 3 p.m. Eastern Time. So we look forward to seeing your community stories there. I'm pleased to formally introduce our guest, Susan Brutschy, the co-founder and president of Applied Survey Research, a nonprofit community research organization. She is an experienced sociologist and an expert in community assessments, program evaluation, strategic planning, and measurement of community well-being. She specializes in the use of results-based accountability and collective impact to link program performance to community results. Susan helps community members use their data to improve their communities. Her belief is that data should not sit in binders on shelves collecting dust, but rather that data should act as a catalyst for change in communities. She encourages her partners to view data as a friend and to pursue the establishment of a culture of accountability as a way for communities to thrive. So welcome, Susan. To start off, tell us a little bit more about your work at Applied Survey Research.
Yes, ASR has been in business for over 35 years, and our mission is to help build better communities, and we do that in a very participatory manner. always trying to help our partners be able to tell about the contribution that they make in their communities. And what you see on the screen right now is a list of many of the communities that we have worked with over the years. I know today we're going to be focusing primarily on Santa Cruz County, which is our love and passion, but wanted to let you know that results-based accountability and thinking about ways to use data are something that ASR has been doing for many, many years with many different types of partnerships. And one of the reasons that we really like results-based accountability is that it really keeps the heart and soul of why people are working to improve their communities. So we'll talk a little bit more about that as we get going. Let's turn our attention to the Community Assessment Project. And Sarah or Karen, did you want to ask a question before I head on in? Okay, seeing none. So the Community Assessment Project, what you see in front of you is the cover of our 2015 report, which is embargoed right now, so you're getting a sneak preview. And we'll be releasing that in November. Every year for 21 years, we've been releasing a comprehensive report and also having a celebration of the impact that our community heroes have made in reaching some of the community goals that we've been setting in the Community Assessment Project. A little bit about Santa Cruz. We're a somewhat smaller community by the ocean in the middle part of the state of California. There's 58 counties in the state, and we're a smaller one. So a kind of a reputation for really working well across the community. We have the University of California at Santa Cruz, who are excellent partners. The partnership with the Community Assessment Project was really with the United Way, Dominican Hospital, and the Health Department, as well as other community-based organizations. One of the things that you need to know about the community of Santa Cruz is that there really is a tale of two cities, and the stories there are quite different in terms of social determinants of health and health outcomes. Watsonville's in the southern part of the county. That's our major agricultural center, whereas the county capital, the seat, is in Santa Cruz, the city in the northern part of the county. Much difference in terms of economics and well-being. We've actually done a couple of different studies on those. So that's a little bit about the background and about Santa Cruz.
Great. So you all have been taking this really systematic approach to assessing your needs and evaluating your impact, as you said, for more than 20 years. Can you talk a little bit or tell us a little bit about how you got started?
Sure. So I think the first thing is to look at our cycle, and look, we have a cycle just as maybe not as fancy as the Take Action cycle, but this has been our process every single year since we got started. Making sure that we have the leadership and participation to measure the right things. There's always new and emerging trends. Collecting the information, analyzing the information, and then taking action. And I think the couple of things to know about this is that we've created new data where data doesn't exist, but we also take advantage of existing data. For example, we've really enjoyed linking and really bringing in the county health rankings into the Community Assessment Project. We've been through this cycle many, many times, and you'll see that Step 10 really focuses in on sustainability and evaluating our own progress. One of the things when we got started was to say we wanted to have one common set of data points that everyone in the county would use. No dueling data sets. So that took us a few months before we even collected a piece of information to really get our key stakeholders and partners to agree that they would be using the common set of data. And then it took us a while to understand what indicators of well-being and quality of life we were looking for. And those are the first several steps of the cycle. When we first began the cycle, we didn't include an outcomes framework because we didn't have an outcomes framework. Now we do, and that's results-based accountability. I think the other thing to make really manifest is that that making meaning of the data is really important. We had 6 domains that we looked at in terms of quality of life, similar to, as Karen was discussing, a holistic look at well-being and health. And we worked with community stakeholders for many months and interviewed and involved hundreds of people to say what success looked like in the 6 domains: health, education, economy, public safety, social environment, and natural environment. What does it look like? What do you want to see? So we didn't go, we had a blank slate in terms of understanding what the indicators of well-being are, and I think that's really exciting. You'll see that the steps 7, 8, or 9 are where we really use results-based accountability to help us take action, and that was really successful in our first action initiative, which was reducing substance abuse for youth. And that was where we turned to results-based accountability, because we didn't have a way to connect what already existed to some startling data that we found when we really looked at our findings. And I think the last thing to say is that the difference in this effort that is not the same as many other efforts is the establishment of community goals, not just being about the data, but a commitment to involve people to make a difference in establishing those community goals. So we have a very rigorous process of revising our survey, making meaning of the data, establishing what the action will look like, and then also making sure that we're really clear about what it will take to involve the right folks in change. So that's the community improvement cycle, and that's basically how we got started, and that's how we continue to take progress along the way. I just have to say how exciting the Culture of Health Award has been for us. Even though we had been at it for many years, it provided a wonderful shot in the arm of excitement and gave us the courage and the belief to tackle some much more difficult issues. So now that we've talked a little bit about the background of Santa Cruz and the Community Assessment Project, this is the concept that is the heart and center of results-based accountability. And that's the concept of turning the curve. That the indicators that we have been tracking for many years are not immutable. We can change them. And this concept of the upward slope is really important to us. What does success look like? And how do we achieve that for all? So this line about well-being for all, we can describe to you what well-being means, and then we can also bring in the all and define where we are in terms of who we are with the all. We can define that, and then we can show progress along the way. And we can also show where we're not making the progress that we want. And that's what we saw when we compared Watsonville outcomes to the rest of the county, and we're not happy with the disparities that we saw. So let's go a little deeper.
That's great, Susan. Thank you so much. Yeah, as you're starting to lead into your next bit, I think it's really important that now that we've talked about the why of doing results-based accountability and what it's doing for Santa Cruz, if we can start talking a little bit more about the how. How does this actually work, and how has it worked for you?
Beautiful segue. Mark Friedman from the Fiscal Policies Institute is the author of this companion book, Trying Hard is Not Good Enough. It's in its 10th anniversary. We love that name. Trying hard is not good enough. You need to be much more systematic. So wanted to also point out that there's been over 50,000 of the books sold so far, and hundreds and thousands of people throughout the world are using this methodology. The reason Santa Cruz turned to this methodology was because we thought it was really built on premises of common sense. We thought it was very inexpensive, free. All of the handouts, everything is available on our website. We would be able to sustain it, and those were some of the values that were really important to the project of the steering committee. So some of the things that we will go in a little bit more specifically are the major components, the difference between community population change and program and initiative change. That's the concept that it's takes everyone in a community to make progress on some of these complicated issues. The importance of a common language when you're working across different partnerships, different organizations and institutions, trying to establish a common way not only of using the data, but to talk about the data as well. Determining the end and working backwards towards the means. That's the whole title of what we're talking about today. And thinking about the quality of life conditions that we want to achieve for children, adults, and families in our community and in our programs. And that's really, really an exciting way to start. You envision what you want, and then you say, what will it take to get there? And that was a perfect fit for us in Santa Cruz, because that's how we began all of our community convenings and continue to do so. The concept of turn the curve, already mentioned that. We'll have an example coming up. Effect versus contribution. When you're really thinking about the action, it's different to hold yourselves accountable across different domains and partnerships to turn a curve, as to say, and using the language of a contribution as opposed to did you cause something to happen. And that contribution effect is really important. And then finally, aligning programs and community efforts and what that looks like.
Thanks, Susan. And I know when we were talking about this webinar and putting this together, one of the things that you highlighted was that these major components is one of the most important things that folks can take away from this. So we wanted to actually take some time to walk through each of these concepts in the context of Santa Cruz County, so we can dig into each of these 6 concepts, these major components in more detail.
Great, sounds good. So let's turn, yes, here we go. The big distinction in terms of thinking about whole populations are people in a county, community, our age group, cities, counties, states, nations. That's your big picture of who you're talking about at the population level. And then really thinking about program population. That's a particular subset of the whole population served by a program, a service system, an initiative. In the case of, so it's quite important because I think it gets back to that piece about who has the responsibility, especially for health. And it's not the health department that has responsibility for the health. That is a desired condition of well-being for all. And so making sure that when you're talking about the whole population of a county, that you're not holding any one effort or program or initiative responsible to achieve that. It takes all to be able to achieve well-being for all. And for us, the example that I'm going to be turning to is that Santa Cruz had been having public safety and social environment as a domain, and we had noticed that there started to be a big uptick in concerns about neighborhood safety and gang violence. And that was kind of the precursor for us to say, what's going on there? Let's really start to look at what's happening in the world of youth violence, and that will be something that we'll continue to explore as we go further. The next slide shows us an example of what we started to see when we started breaking things down, and what we're really understanding, that we saw incidences and trends increasing in terms of youth and youth involved in violence. And so we decided to really conduct a results-based accountability effort to turn the curve on youth violence in the community. And then this pie chart is a way to say, okay, so we understood that youth were involved in violence. There was a lot of concern by adults and youth in the county, and we really wanted to focus in on certain areas. So here's an example of when we started looking at, let's talk about what are the youth, what numbers are we thinking about in terms of school, what data do we have. We could tell from our reports from our California Healthy Kids survey, youth were not feeling safe at school, and we began to see some uptick in terms of school climate initiatives and environmental-wide at our sites. And then eventually we began to see that anti-bullying programs were springing up. And so that's just a way to distinguish the theory of change that connected the population accountability to the programs that were involved. And that's a major component of results-based accountability. Let's keep on moving it and talk about another really important aspect. And that's establishing, as I mentioned earlier, a common language. Not only a common language with the data and understanding and an agreement about what the data means, but a common language to talk about it when you're going to take action. And here's an example where you see the distinguishing between population and program. A community result is a measurable improvement in community's well-being. And what's an example of that? A safe community. We wanted a safe community. The data point is the indicator that measures the status of a community result, and that's the overall crime rate. And then the performance measure. We're not looking at the program accountability measures anymore. We're really looking at performance and programs and initiatives. And the performance measure is the difference the program makes in the lives of its participants. For example, lower recidivism rates for participants that were participating in Program X. So already you'll see the very careful delineation. The way that we use the language telegraphs whether we're at the community level, population level for all, or are we at a program level where we're looking at certain population groups and certain types of inputs that we know will make a difference. In Mark's book, he calls it the language trap and says that there's a lot of kind of not precision or a lack of agreement on what language to use. And if you string all of these ideas, outcomes, indicators, measures, targets, everything gets really, really hazy. So really being sure, establishing that language discipline is a very important measure. And it's really nice because someone says performance measure, you know exactly what level they're talking about. How did we put that into play? Let's look at a couple of examples from our Youth Violence Task Force. Basically, the left infographics provide a link to the Community Assessment Project. We did a Youth Violence Prevention Report, again using the same cycle, having folks tell us what they were worried about, what was going well, making sure that we did not engage in youth blaming, that we were strength-based, and really looking at positives and where things were working exceptionally well. So the determining the ends and working backwards was very critical for us, and it was that predicated upon, as I mentioned earlier, not wanting to be a youth blaming effort. We really wanted to establish where things were really going well and build off of those. And so that was where we came up with our vision statement, and then we turned those into results. What are those desired conditions of well-being that we wanted for our youth? And this brought different and really exciting new people to the table in ways that we had not worked with before. We had police officers, we had youth, family members, programs that were involved in social and emotional well-being, sheriffs, the health department, so lots of different partners. And we used the results-based accountability, 6 steps, and we'll go through those in a minute, as a way to help us prioritize what were the results that we wanted to see. What was the right data that could tell us what the trends were? And I think it was a very, very powerful exercise, and we really went through the cycle a few times, establishing what those results were and then working backwards and saying, how would we know if we were experiencing those results? If you can see, I'm not sure if you can see in the infographics, but we have overrepresentation in juvenile hall, and that's a very, very sensitive issue, and we were able to have the right kind of conversations because results-based accountability provided us the discipline to do so and to move forward, but also in a way that was respectful and kept the passion and the hopes and the dreams of our youth and their families in the process. Let's look at what it looks like when you actually get to the place of turning the curve. There we go. So when in our community assessment, we have literally hundreds of these trends that we've been able to track. Here's an example out of the Youth Violence Prevention Task Force, and what we looked at is okay, what's the result that we're seeking? We want safe schools. We want students to feel safe in their schools. The indicator is the percentage of students who report feeling safe at school. So what we saw was the indicator was going the wrong way. A very important aspect of turning the curve is telling the story behind the trend, making meaning out of the data, as I mentioned earlier. Students are being harassed, bullied, and threatened at school, and it wasn't happening across the board in the same way throughout the county. So really keeping a local and a geographic lens on this was really important. What you'll see is the other thing about the story behind the trend and why it's really important is that this is where you start to see some of the disparities, as I mentioned, start to come up as well, and really want to honor where things are going well, but really not be afraid to talk about where those disparities exist and what can happen with them. We'll talk a little bit about the action coming up, but I wanted to point out that trend with the action. That's where you say, okay, if we don't do anything, the trend is going to keep getting worse. We're going to have fewer and fewer students who report feeling safe at school. And that's really related to some of our other outcomes as well that we're trying to achieve. One of our efforts, another reason we think that the culture of health was interested in Santa Cruz is that we have several projects that are linked. The Go for Health project is really working on safe routes to school. So these two things were interrelated. The trend with action going the right way, if we can turn that curve and make the trend go the right way, our idea is, and certainly Mark's idea, and we've seen it, is that in allocating resources and having a correct theory of change, you actually free up resources. And that kind of the difference between the trend going up and then the trend going down results in costs saved and money that can be available and resources and time that can be available for prevention and maintenance of activities that are working really well. So we'll keep on going. We're going a little deeper now into the aspects of results-based accountability. This is that concept of the effect versus the contribution, the fact that it's not just one partner who has a role to play in turning the curve. You need a lot of different types of partnerships. Now, when we're looking at these performance measures, we've gone from the population level to what's usually called as straight up evaluation. You had some ideas about what action would take to turn the curve. You've been doing that, and then you want to say, okay, are we having the impact that we wanted? And this schematic really helps to distinguish between effort and quantity of services, flat out how much did we do, what was delivered, to the concept of the effect. Is anybody better off? Yes, we did a lot of things, but is it having the impact that we want? Is it directly connected to the achievement of those results? Are we seeing those community level indicators turn the right way? Is the curve turning? So this is the concept of distinguishing between effort and effect and quantity and quality. Now, I wanted to point out that the quality quadrant is really, really important. How much did we do is quite important too. That's where you talk about the different types of recipients, who's receiving the services and support, are they being targeted to the right types of groups, and are those groups receiving them? And the quality is that this is where you can say, are we following a fidelity to the model? Are we using evidence-based practice? Are we able to collect the data that we need? And also, very, very important, this is where equity resides. Are we seeing disparities? Are we able to track the disparities? How do we make sure that everyone has access to the services and the supports that are required? And then I think the exciting thing is anyone better off is the quality of life change, the actual change that's produced, and really having a nice way to be able to think about what that looks like. And if we go to the next slide, you'll see that is anybody better off links to the community result. And this is how we can talk about alignment. And this is probably one of the more complicated visuals, but it's really trying to put programs and initiatives together with the community's result that you're trying to achieve. And the thing that we haven't talked about is when you are thinking with the results in mind, you develop your theory of change, say what will it take to achieve that. And that theory of change is really important. That's your kind of your if-then statement. If we do these things with this group of people in this way, we should see X. If we don't see X change, then we're going to modify our program until we get the outcome that we want. And I think that's really important. So here's an example.
Sorry, Susan, I hate to interrupt, but I wanted to jump in with a quick question that I think relates to this slide. So before we moved on, I wanted to set you up with this question from Jody, who is wondering if what you're doing is basically measuring the difference that you see in a program population and then making inferences for the community population. Can you talk a little bit about that relationship?
Yeah, that's great. Great question, Jody. You anticipated that the need to talk about the theory of change. The theory of change is the best ideas about what it will take to have impact on that community level indicator. And in fact, you need a constellation of different types of partnerships because different types of programs and different types of expertise reside in communities, and there's different types of needs. So you're trying to customize your outcomes so that that you'll reach every single aspect of your community. For example, some of the things that we are seeing in Santa Cruz County is that a program that is about anti-bullying is going to look different in the city of Watsonville than it does in the northern part of the county. So you don't really want to have a cookie cutter approach. You want to use your theory of change, which says kind of how many units of services do we need for our youth in each one of our geographic areas, and how does that fit together within a prevention type of approach. This is the alignment slide shows that you would track the receipt of the students that were participating in a strategy, making sure that you're conducting it and following the fidelity to the model, and that you should see a change in the students of one neighborhood area who report being bullied or harassed at school. Then you know that you're making a connection, an alignment to that community result, especially if you're delivering it to the amount of students that you had anticipated. So the 6 steps. This is the process that we did and to help us determine what the strategies that were going to be successful to turn the curve were. And we did this with the Youth Violence Prevention Task Force, and we really held firm to going through systematically, step by step by step. And I would say this is one of the biggest learnings. I know that you had some questions come up before when you registered, and many of you asked about how do you hold the line, what's the process to decide what's important. And we followed these steps, and that was how we had a decision-making process to understand what the results were, what the priority of in terms of what results to focus in on. As I mentioned, thinking then, we went and collected the data if it didn't exist and made sure that we tried to slice and dice the data as much as possible so that we could be really specific about how many students did we really want to receive those anti-bullying programs, for example. So the data comes through many different times, making sure in the story behind the trend that we talked about the over-representation of certain groups. And then the partners with a role to play, the key partnerships, very, very important. These are partners that are actually involved and they have a role to play. It's not necessarily that you have advice. because we're really at the action part right then, and we also really want to make sure that we are aware of the activities that are already going on. It's not always about creating new programs or creating new partnerships. Many times it's just working differently with the same programs, and we certainly are finding that now. The best 5 ideas for turning the curve and improving the outcomes. We always ask for a low-cost, no-cost solution. This is another area where there's a lot of questions of how do you do this inexpensively and without a lot of support. And we always include not only that question of what's a low-cost, no-cost solution, but we always try to keep in a question of what can we do tomorrow without any new resources, without anything new, just by thinking differently about the results that we're trying to achieve. And finally, a strategic plan. What are the strategies that are best suited to turning the curve in the areas identified above? So those are the 6 steps. You can get pretty good. You can go through it fairly quickly. We've spent hours and hours over and over again. This effort is actually able to be done in an hour if you want to go that quickly. I know that you're going to see some examples of some of the handouts and some of the materials that are existing. I think the video, as I mentioned, is really exciting because it can show Mark leading through the 6 steps. And I just want to say that it's really exciting to have all of these results pages done for every single result that we're trying to achieve in establishing an end of violence in Santa Cruz County for our youth. And really having gone through those 6 steps, we can tell you exactly what the numbers are, what we're doing, and pretty soon we'll be able to tell you if we're making a difference or not. So the last thing as we start closing down is RBA in a nutshell. It's 2 kinds of accountability. It's population accountability and it's performance accountability. And it's also the language discipline that goes along with it. It's 3 kinds of performance measures. How much did we do? How well did we do it? And is anybody better off? And it's those questions from ends to means in less than an hour. Establishing baselines and really understanding what it'll take to turn the curve, to achieve well-being for all. The last thing I wanted to just say is that the results-based accountability really does do, as Karen mentioned, in terms of distinguishing between the what's and the how's. And I mentioned how exciting it has been for Santa Cruz to receive the Culture of Health Award. It really got us thinking about the fact that we had established a culture of accountability. And the cycle was a part of it, results-based accountability was a part of it, using something that people now are calling collective impact. That headset was already there for us. And I think why we wanted to end here was the aspects of the plan that are really important: data collection, reporting, action, sustainability, collaboration throughout. And in achieving a culture of health and really focusing on a culture of accountability, we can measure the hows as well as the whats. And I think it's really, really important. I don't think we do enough of that as a field, and it's really exciting to be on the conversation with you all today and to be a part of the field as we really say, let's hold ourselves accountable for the ways that we work together, for the types of investments that we make, and for keeping our eye on equity and equal access so we can achieve a culture of health for all. Thanks a lot.
Thank you so much, Susan. This has been really helpful. I know for me personally, and I'm sure for those joining us on the webinar, I wanted to take a moment to put these reflection questions up again for folks to think about a little bit as you consider what questions you might have for Susan. Who else do you need to share this information with? What is one idea for action that you're taking from this webinar? And we always love to hear those too, so do feel free to chat that into us. But what else do you need to know to be able to take action and to be able to use this use this information. So I'm going to leave these reflection questions up while we go through some questions that you've been posing throughout the webinar, and I know Sarah has a collection of them. So we'll start with those, and then please feel free to share your own questions. And again, ideas for action that you have that you're taking with you from the webinar. We'd love to hear those as well.
Great, thanks, Karen. So we've got some great questions here. Erica posed the question that I think might be a good one to start with, Susan. That question was, this sounds like a well thought out and intentional process. How did you convince members of your group who were eager to jump to a solution to take time to complete the process?
Fantastic question. I think one of the things that we've noticed is that the more and more people that became familiar with results-based accountability, the more allies we had in terms of support for going through the process. And I think that's important because we had successfully used the process over and over again. And it was particularly important when we brought brand new partnerships to the table with youth violence prevention to really have folks that had seen that results-based accountability works and that it can work fairly easily. So that's one thing, is just having kind of allies in the field. And then I want to also say that, you know, most of the issue came with not starting with the ends in mind. Rather, starting with what are the programs that we have right now, and trying to do an assessment, a look at all of those programs, and building the model from that way. So that really was something that we kept having to turn to. And the nice thing is, by beginning with the results in mind, I think that that's where people all agree. There's not anyone that's not going to say that they don't want well-being for every single youth in the community. So just making sure that you've got that agreement before you go to each step is really important. And then every once in a while, you keep doing a refresher course, you keep getting deeper and deeper, and then sometimes when you have new folks, you need to bring them up to speed as well, and not expect that there's a lot of comfort with the process, and really being open to giving folks a chance to kind of pursue the methodology deeply before they kind of joined in. Of course, I'd love to hear if other people have other examples of ways that they have used a fairly disciplined approach with a wide group of people.
Susan, Vicki has a kind of a follow-up question to what you've just been talking about, and how have you been thinking about who you need to be inviting into this process and including in this process, thinking about community leaders or decision makers, citizens? Are there any criteria or tips that you might have for others who are thinking about who do we need to be including in this network of people working in your community?
Yeah, I think it's a great question, and you know that we have different ways that we involve people at different times too. The first kind of answer is that we really like people with a role to play, people that are involved, and you heard me say that before. So, for example, a probation officer might be sitting at the table right next to a family member who is working with their school, their students, their child's high school, and so those are completely different roles to play, but both really important if you're thinking about what strategies are going to be successful. So that concept of a role to play, and then really making sure that all of your processes are appropriate, so everybody has equal access to participation, to understanding and making meaning of the data, and a way to give advice about what would be successful or what's working or what's important to them. And then in this place, we doubled back a little bit. We we needed a little more information about the social emotional aspects, especially for youth that just needed a little support, that hadn't gotten into issues or deep trouble, if you will, yet. And we did some very specific focus groups and key informant interviews halfway through the process. And that provided a safer way for folks that might not have felt comfortable attending the meetings to give feedback and ideas and process. So kind of broad and narrow at the same time was a really nice way. This Youth Violence Prevention Task Force was probably one of the bigger initiatives and efforts that we have done in the county, though we've been in the doing this for many years. Even with the Goal for Health, there's something about this effort that people really, really want to get involved in. So now we're going deeper and deeper and deeper and looking at specific neighborhoods and specific jurisdictions. So we're kind of tightening up yet again as we really think about those strategies. And we're bringing new people to the table and again needing to double back and say, this is the strategic plan, these are the results. Now we'll tell you, we've got a process, but we're recreating now based on the premises and the work that had already been done to say, what will it take to work right here in your neighborhood? And that involves us bringing new people to the table again. Thanks for that follow-up question, Thing.
Thanks, Susan. So the questions are coming in fast and furious, and there's one that came in from Judy. Judy wondered, how is the evaluation of both programs and populations funded in your community?
Good question, Judy. We've had some interesting partnerships in terms of funding, and basically this is not a very well-funded program, and in fact we actually kind of our effort. We kind of say that's one of our strengths. So when we're working in Watsonville like we were last week and we're kind of saying, okay, what's it going to take to turn the curve on this? We come at it from the place like, well, we don't have brand new resources. We need to we need to do what we can with what the existing resources are. So I think that's been a strength, not only the community assessment, it's been self-funded and sustained the whole time. And we're approaching this Youth Violence Prevention Task Force and all the other initiatives in the same way. Nevertheless, we have had some support for organizing through our wonderful partner, United Way, fantastic leadership, and they have funded applied survey research to help out with a little bit of the data collection. So again, having our community partners tell us and prioritize the data that they need and how we'll be able to say whether we're making a change or a difference. Definitely it's guided by how much, how well, better off. So that part we're good with, and getting that as the way to tell the story. But I think that part of it is just this prioritization. We know we can't measure everything. We know we can't do everything. Together, we have to decide what's possible. And sure, it probably would be easier to have us, lots of money to do this, but we actually have seen in the past that the low cost, no cost, the what can we do soon, how can we partner and build on existing resources, what's the role of informal support and programs are really, really important. We think it keeps us nimble and humble. But if Judy has any ideas, she'd love to hear about them.
Susan, this is so great, and when Sarah says the questions are coming in quickly, she's not kidding. We have lots of great questions here, but we only have time for one more before we move to closing up the webinar. I wanted to remind folks that we will have some instructions. If you want to stay with us, we're going to have about 10 to 15 minutes of after-class discussion or continuing some of these questions that we haven't gotten to during the hour. So please feel free to stay with us, and again, we'll have a couple of instructions in case people want to bring their voice into the conversation. We'd love to hear from you directly. So Sarah, one last question. You got it? Yeah.
Great, thank you. So Melissa had a great question. She asked she'd love to hear about specific strategies used to target disparities. She noted that they've had success affecting change with the whole population, but less with achieving well-being truly for all.
Yeah, great question. I think one of the things, first of all, is making sure that it was just, it was alive at every aspect when we've been working on this, and that the issue of disparities does not go away. We've been really careful about the language that we use to describe the progress that we're making, and how we talk about some of the solutions. I think the language was really important, and I think bringing the numbers, really the numbers into the conversation has also been really important. Are we talking about 500 youth in juvenile hall, or are we really talking about 50? Are we talking about police activity that's different in one area versus another? So I think really being precise about what group of the population that we're working with is, and then really understanding what the possibilities for success has been really important for us. And you know, it's a sensitive conversation, and I have to say, as a numbers person, I think the numbers can help us have that conversation in a more respectful way than sometimes we usually do. And that concept I talked about, the youth blaming and not wanting to blame youth, but really coming from a strength-based approach, remembering that we all agreed what those desired conditions of well-being were. We all agreed what a wonderful community it is if we achieve those. When you get into kind of sticky water, and then getting right back to those numbers. Okay, the trend's going the wrong way. This is not in keeping with what we agreed we wanted. And then I think the theory of change is the way out. We really believe in that concept of the theory of change. If we do these things with this group of people, what will we see? And equity is there. That doesn't mean that everybody has access to all of the same services. It's the group that needs those services gets those services. And I think that's where the concept of the social determinants of health is so important to this. And what we have found, I'll just end with this, is that, you know, I think really getting to the place of understanding what the demand or what the need for the services are, and then really looking at what we have, really helps out a lot. Because what you'll see is that the disparity exists because they're probably not getting some of the support that is available, but they haven't been able to access that, or that there isn't enough of that service or support. I mean, some of these things are basic in terms of ideas. It's participation at planning bodies. It's having families and youth involved. I mean, I didn't say it, but over and over again, the youth themselves need to be involved in planning for their own success.
Great, thank you so much, Susan. We're gonna wrap up the regular hour of our webinar, and we'll, as I mentioned, we'll have a 10 to 15 minutes of after-class discussion and continue some of these great questions that we have here. For those of you who are not able to stay with us, we understand that an hour is a lot of your time, and more than that can be too much. But I wanted to let you know that we will be recording that after-class time, so feel free to check in on that later once the recording is posted later in the week. So as we wrap up, we want to let you know that thanks to the support of the Robert Wood Johnson Foundation, we have 11 community coaches based in Madison and regionally around the country, and our assistance is available at no cost to you. Community coaches provide community leaders with direct support to strengthen their capacity to advance health improvement efforts in communities. Our coaches use the County Health Rankings model, the Take Action cycle, and the RWJF Culture of Health Prize criteria as frames for their guidance. What Works for Health, a database of evidence-related strategies, and the Action Center content are practical tools that community members and coaches use to move from planning into action. So you'll find, you see on the screen, you'll find these orange boxes located throughout the Action Center, inviting you to contact us for personalized free help. This is the best way to connect with one of our community coaches, so please don't hesitate to contact our coaches if you need assistance with a tool, a question, or figuring out the next steps in your process. We always invite you to stay connected with us. You can use social media to keep in touch. You can find us on Twitter, like us on Facebook, or sign up to receive our e-newsletter. And we also like to take a moment to note that this program is the result of the contributions of many partners, including those listed here. At the beginning of the webinar, we introduced this guiding question, and we hope that today's discussion has generated some new ideas and thoughts about how you can use results-based accountability to help your community build a culture of health. Shortly after today's webinar, you'll receive an email linking you to an evaluation survey for today's webinar. Your feedback is incredibly important for developing and improving County Health Rankings and Roadmaps webinars. If you'd like to take a moment right now to complete the feedback, Sarah has chatted out the link, and so it's available for you to jump online right now and fill out that survey and let us know what's working for you and what we could be doing to make this a better experience. So as I promised earlier in the webinar, we have some instructions for participating in our after-class discussion. If you want to speak during the after-class discussion, and we would love to have your voices in the room, if you will, what works best is if folks move to the telephone option. So how you do that is you can switch to telephone using the audio section of your control panel. Here you'll find the phone number and access code, as well as your unique audio PIN. That unique audio PIN will allow us to unmute you during the discussion. To let us know that you'd like to ask a question or add a comment, you can click the hand icon to raise your hand. If you are interested in just listening to or participating via the chat box, that is completely fine. There's no requirement to switch, but if you want to bring your voice into the room, you want to actually ask your question out loud, then that's the way to do it. I will leave those instructions up in case you feel inspired to ask a question directly to Susan as we continue this discussion. So let's keep rolling into a little bit of extra time for questions. And Susan, you were wrapping with talking about the importance of that theory of change, that's a really important part of developing and implementing results-based accountability. We had a question earlier in the webinar about when you were talking about this before, during the presentation, you talked about how having a correct theory of change can help free up resources. And Melissa was wondering if you could say a little bit more about that. What does that mean? How does having a correct theory of change free up resources?
Sure. Well, I mentioned when Judy asked the question about how we were funding things, and we actually got from our sheriff's task force a contribution. And the contribution was basically because the sheriff's office, and basically it came from the other chiefs of police as well, felt that by preventing deep end services like juvenile hall, like incarceration, that resources were going to be freed up. It costs a lot more money to house a 19-year-old in jail than it does to provide support within the community. And so that the cost of that slide that I showed in terms of turning the curve, the difference between the good results going the right way and not going the right way is a lot of money in deep end support. So it's that concept of, we know that prevention and very light touches are way less expensive than the deep end services. Results-based accountability and a theory of change lets us know about what that estimated need for those deep end services are, and then really try to drive down those the expenses and reduce the number of folks that need that. And then that concept is kind of like the least restrictive, or the least expensive or high-end supports. And in the juvenile justice area that we've been working with a lot in the Youth Violence Prevention Task Force, they call that suppression. And suppression dollars are really expensive. So really flattening it out. And we think that there's about an 80-15-5. You might have heard this before, that 80% of the resources actually can go into prevention and maintaining what's working. And that, you know, about 15% need a light touch. Maybe a little bit of connection, maybe something went wrong once, they can get a little bit of help, they move along. And then gathering 5% of the resources to really be right for the types of very deep support that's needed. And making sure that you've got the access and that kind of a system through your theory of change to get there. And why we like that concept of the theory of change is that it's also inherent that the system or your theory needs to keep changing and modifying. And part of the skill that you get and that we need as a field and as community folks is that ability to constantly be adjusting. No blame. But with accountability to say, well, we tried this, it didn't work with this population. It worked in Watsonville, but it didn't work in Santa Cruz. What are we going to do differently? We didn't provide enough support. We need extra hours. How can we get that? So you're having completely different conversations, and if you've got a kind of that system of care approach, the resources are spread out appropriately. We do a lot of work in homelessness. And you know, the costs of housing or hospitalizing or incarcerating homeless folks is so much more than if we had an early intervention process that would be like, okay, we're going to prevent evictions of families. So it's just that kind of switching what the result that you're seeking is, and then asking the question in results-based accountability is, what would it take? What would it take to do that? And that's looking with the results in mind. Not what will you give us, what do we have, but what will it actually take to achieve it for all? Thanks for that question. I'd love to see how other people are thinking about theories of change. And systems are definitely big right now. Everybody's talking systems.
Thanks, Susan. So we have some more questions I'd like to bring to your attention. Before I do that, just a reminder to everybody that's still with us for this after-class portion that if you'd like to raise your hand, we can unmute you so you can enter the conversation by voice and not just through the chat box. But in the meantime, Susan, another question came in from Judy. It's a great one. She said, how is the data available to the community for program development or other planning, so i.e. housing or transportation?
Nice. Well, hopefully those folks have been at the table too to help us create the results, to make sure that we have some of the right data. It's definitely on our website, it's in our plan, and it comes to them not only as data, but it comes to them as those 6 steps. And I think I mentioned that that's what our strategic plan looks like, those 6 steps for every indicator that our group said they wanted to impact. So I think that having the data be available is really, really important. And then really encouraging our partners to start linking and aligning and talking about the contribution that they make. Many times our community-based organizations are making contributions that are invisible, that people don't know that they really are in service of some of these results, and they're not seen, they're not appreciated, or the programs themselves don't have a way to make that connection. And I think that's that concept of contribution versus attribution, that programs can make a contribution to achieving a result, but it doesn't mean that they have to be held responsible for the entire result. And I think that the data is one thing, Judy, but I also think it's the ability to be able to tell that story of contribution, to be able to link, and to be fearless about talking about community results. I think our programs got kind of scared when evaluation first started coming, and evaluation became kind of a hammer like it's a gotcha. No, it's not a gotcha. Our programs are proud of why they contribute what they do. There is a theory of change that it can express their ideas. It many times are based on evidence-based practice, and they can show you at least 1 point of how much, how well, and better off data. So I think it's the capacities, the safety, and a little bit of support to think about alignment and contribution that really needs to take place. It's not only the data. We've seen it many times in other communities that just having the data there isn't enough. People need to want to use it, to feel safe to use it, and to be honored and rewarded for holding themselves accountable. Uh-oh, Judy, I'm getting emotional over here.
Oh no. Well, let me take you in a different direction then.
All right.
We have a question from Amy, and she's wondering if you have seen examples where results-based accountability has been used successfully in rural communities.
Yes. We've been using results-based accountability in Alaska for over 10 years, and not only in Anchorage, but in other of the communities as well. Providence Hospital, in partnership with the United Way of Anchorage, worked to build results-based accountability initiatives once that they had done their assessment. So it's very exciting to use it in rural communities, and I think it's a natural fit, because I do think that it's a kind of a common sense way to explain and explore, and that's one. And then throughout the world, I mentioned that, well, I guess I didn't mention that our RBA partners are having an international conference right now in Sydney, and they've got the best and the brightest of people that are using results-based accountability throughout the world meeting right now, right where we're having our conversation. My colleague from ASR is there talking about how she's been using results-based accountability to end homelessness in different communities. And in the international field as well as nationally, lots of examples in using results-based accountability for school readiness. Especially Annie Casey's been very interested and has been thinking about it and using it in terms of child welfare. Again, really important issues in smaller communities where the partnerships are so strong, and the ability to take actions pretty quick. So lots of examples there. We're using results-based accountability in Solano County right now, and very, very interesting in terms of, that's kind of a rural county in Northern California. And again, just seeing the difference in terms of one part of the county versus the other. We've also done some work in Arizona with rural populations as well. Thanks, Amy.
Oops, sorry, Susan, we're challenged by the mute button. Okay, so we're coming up on our last question here. I'd like to end it on a fairly big one, a question that just came in from Judy. So Susan, Judy asks, do you have any data points in the plan that address broad goals such as health equity or quality of life?
Well, yes, and we had kind of 3 major work groups that we were using in youth violence prevention. It was safe kind of communities, strong families, and supported youth. So within each one of those, there are relationships to social and emotional well-being, for example, and access to services as well, and what would it look like if those that needed services could get them. And the social emotional well-being stuff has been really, really rewarding, and we hadn't anticipated that we would get so deep in terms of some of those aspects, and I think results-based accountability has been really helpful to kind of find a neutral way to really talk about what support would look like for families and for youth. So that's number one. And number two is that some of the softer sides of this come through in some of our data sources as well. We we also depend on the community assessment project. We've asked people if they feel safe in their community. Is there somebody that they can depend on? We've asked questions about quality of life from the very beginning, and we also just added this year a question about life satisfaction, and that's the Gallup life satisfaction question that's done throughout the world. So we can compare life satisfaction for different groups in Santa Cruz to other different groups in the rest of the world. And that's kind of where we're going deeper and deeper into this well-being. And it happens at different levels. It happens at the community level. It certainly happened when we were developing specific strategies. And now that we're at the neighborhoods, we're really getting a different idea of how to connect and tap into some of the strengths that are existing that can help prevent youth violence and help increase well-being for all. So it's very exciting and very rewarding.
Susan, thank you so much for all of your insights and your expertise. This has been just a really rich discussion, and we want to thank you for spending some extra time with us and going through some of these additional questions and sharing just so much of your story that you've seen unfolding in Santa Cruz County. So thank you so much. Hats off to you for all of your work. For those of you who are with us, again, your feedback is so important to us, and we ask that you'll take a moment to share your thoughts with us. The link is in your chat feed. You'll also be receiving an email after the webinar, so please feel free to use either one, whichever works better for you, to let us know what's working for you on our webinars and how we might be able to make them more meaningful to you. And with that, we'll close it up today. And Sarah, thanks for your support.
Thanks everybody for your great questions.
Yeah. Have an excellent afternoon. Thank you so much.